In Kansas, preterm birth is one of the leading causes of infant death, and as you know, we've been focusing on infant mortality over the last 3 years with our Blue Ribbon Panel on infant mortality, and particularly looking at some of the disparity in our infant mortality rates, where it's more than double in our black population compared to the white infant mortality rate. The good news is that while preterm births contribute to infant mortality, preterm births are one of those items that are preventable. I'm a member of the Association for State and Territorial Health Officers, or ASTHO, and when looking at all of the health issues facing the nation, last year President David Leahy from Texas looked at the infant mortality rate, and particularly prematurity. And as he looked at the rates and what was the target we shoot for in Healthy People 2020, he saw that that rate was 11.4%. And to get to that rate, we would have to reduce the prematurity rate in the United States by about 8%. So President Leahy, along with March of Dimes, presented a challenge to all of the state health officers that if we would accept the challenge of working to reduce our state prematurity rate by 8% by the end of 2014, that'd go a long ways to accomplishing our Healthy People 2020 and our Healthy Kansas 2020 goals. So I'm happy to tell you that I accepted that challenge on behalf of KDHE and the state of Kansas, and I'm glad to be continuing to work alongside with March of Dime and many of our other partners to help prevent prematurity. By the end of 2014, as I mentioned, our goal is to reduce our rate of prematurity by 8%, taking it from 11.2% down to 10.3%. That would be about 350 fewer preterm births. So to provide a little bit more background on the March of Dimes involvement in this effort, I'd like to introduce Diane Daltrey.
In our state, 1 in 9 babies are born premature, and that equates to about 3,600 births. It's a significant number. Babies born too soon have significantly increased costs for medical care and for education long term, and all too often they don't live to see their first birthday. The March of Dimes is working to change this through targeted investment and interventions throughout the state. And these interventions are designed to educate families, provide enhanced prenatal care services, and foster collaboration among healthcare organizations so that we can stretch our resources further. These programs will save babies' lives. That we're launching and we're investing our resources in is a program or initiative called Healthy Babies Are Worth the Wait. This is an initiative that focuses on eliminating early elective deliveries. Early elective deliveries are non-medically indicated, typically inductions and C-sections that quite often are in place for convenience. Could be convenience of the family, convenience of the practicing physician. It could be for convenience if you've got a military deployment that's coming up, for instance. Well, we want to make sure that we begin to curb those and at some point eliminate them entirely, because these early elective deliveries are just a few weeks early. However, they have significant impact on the baby. Lungs may not be fully developed. The brain size isn't the same. There are respiratory issues. This is a group of babies that quite often are the repeat readmits, if you will, into the hospitals because they have complications after they go home. A common misconception is you're pregnant for 9 months, 4 times 9 is 36. That is not a full-term pregnancy. A full-term pregnancy is 40 weeks. So these EEDs, these early elective deliveries between 37 and 39 weeks are what we're trying to curb.
But our black infant mortality rates are still among some of the highest in the country. In 2007, Kansas actually had the highest rate of black infant mortality in the United States. While these rates have also decreased over the last few years, we still see black infants in Kansas dying at almost 2.5 times the overall rate of white infants. And all infants in Kansas are dying at rates that are higher than some third world countries.